All right, great. So talking about the vaccine. So where we are with our vaccination, well, we're doing a fantastic job with vaccination. We've really ramped up our capacity to deliver vaccines to Mississippians. We've seen great success through our drive-through sites, and we've seen increased activity through our partners and their ability to get vaccine out. So you can see if you look at the New York Times and other places that we've catapulted really pretty rapidly in the rankings as far as getting the vaccine out. We do have a challenge, though. If you consider who all is eligible for vaccines, those who are healthcare workers or those who are over 65 or 16 and above with chronic medical conditions, that does comprise a large part of our population, about 1.3 to 1.4 million people. That's a lot of people in Mississippi that now qualify. But if you look at how much vaccine that we're allocated, right now we get a steady stream of about 37,000 first doses coming into the state every week. And when we get those allocations, when we get those doses available to us, we order them right away and they're sent off to different locations so they can be administered. So we don't really have like a stockpile of vaccine. We're using it real time, almost like a real time inventory. And then earlier in the week, we get an allocation of our second doses, which is a separate release. So as we think about this, I think there's several key points we need to consider. First off, there are a lot of people eligible in Mississippi, but there aren't that many vaccines coming in on a regular basis. So we'll need to be patient, but also diligent to make sure that we protect the vulnerable people in Mississippi as quickly as possible. The other thing about that is to understand that the second doses come as a separate allocation that is predetermined. And so if you had a first dose, there is a planned allocation in the future for you to get your second dose. And so we have every expectation that that's going to occur as we step off into the future. With the second doses, we know it's been a challenge for some folks to get their second dose appointments through the online portal or through the call center. And there's a very good reason for that. The logistics of making sure that we have the proper second dose in the right location for each person, it's an absolute logistic monster. But we're working through that. And we have taken steps to make sure that we're going to have more and more availability and visibility on when the second appointments can be made. We did open up about 12,000 additional appointments for second doses. So appointments for second doses going through mid-February. So if you are eligible for your second dose in the month of February and you don't have your appointment yet, please go on and schedule your second dose now or as soon as possible to make sure that we can get you that dose. The other thing is we will be opening up additional appointments throughout the month of February as we have additional visibility on where we are going to have our drive-through locations and also what vaccine availability we're likely to have in each location. So please rest assured that there will be that availability as we go into the future. Going back to the 37,000 a week distribution that we get, our visibility of that doesn't really occur until they're immediately available. And so we were made aware today that we got 37,000 that we can order for the next week. And what will happen is we have those available. We will identify the locations where those need to go. 30,000 of those routinely are going to go to our drive-through sites because that's where we're doing the vast amount of our throughput. The remainder will be shared with partners, especially partners in areas where we don't have drive-through sites. We want to make sure that we address both geographic disparities, but also racial and ethnic disparities. And so we do spend a lot of activity working with partners and identifying locations where we can get that vaccine out, not only to partners who can meet the need because that's their mission, but partners who have a proven track record because we got to get this vaccine out and into people as quickly as possible so that we can maximally protect our populations. We do have some great partners out there and we continue to work with them. Many of them are going to be small clinics, some affiliated with bigger systems, some not. And we've had a great relationship with our community health centers, also called our federally qualified health centers, to make sure that we can get vaccine out to those who are most vulnerable for a whole host of reasons. So that's really all I have for my bit of the update. I hope that helps clarify the process a little bit and understand that, you know, when we have an appointment, we're building appointments based on anticipated delivery, and we have every expectation that we will have vaccines for additional first doses in future weeks, and anticipate seeing, you know, additional appointments being available, and also that for second doses, those should be already covered. So with that, I'll go ahead and turn it over to Dr. Byers, who can give us an update on the epidemiology of COVID in Mississippi.
Thank you, Dr. Dobbs. Yeah, just to let y'all know that, you know, when we look at our indicators over the last couple of weeks, it looks like we are starting to see some flattening of the rapid rise in the number of cases that we've seen so far at the end of last year going into the early part of this year. Even though, with that being said, we are reporting out more than 2,000 additional cases today, 2,290 cases, and along with that, 30 deaths. But if you look at our EpiCurve, certainly we put those on our website, you can see that it looks like there's a bit of flattening in the rise in both deaths and in the number of cases, and perhaps even a little bit of a downward trend in the overall number of cases that we're seeing, although it's too early to say if that's really going to be a long-term trend. We are still seeing a large impact on our long-term care facilities. When you look at our overall state cases, so far since we began this pandemic and reported our first case, now back in March of 2020, we've had almost 260,000 reported cases in the state. And among those, we've had 5,668 deaths. And a good number of those have been in long-term care facilities, more than 1,800 of those deaths. And so, you know, we have continued to see a pretty significant impact in long-term care facilities. That has improved, but we still have over 150 nursing homes that have ongoing active outbreaks even as we speak. And that's why, you know, the efforts to continue to vaccinate those residents and staff in long-term care facilities is so vital right now, because that's going to be a huge win for us when we are able to complete that. If we look at the target groups, and Dr. Dobbs had mentioned that, you know, for those folks that are eligible now for vaccine, that does encompass a very large proportion of Mississippians. When you look at those folks, especially 65 and older, and the impact that we've seen on them so far, more than 75% of the total deaths that we've had associated with COVID in Mississippi have been in individuals 65 and older. And that's why that is so important for those individuals to get vaccinated now. And that's why, you know, we're so grateful that we have the opportunity to really work on this and make it happen. We are starting to see some improvement in our hospitalizations related to COVID. We have had some decreases in the number of confirmed admissions due to COVID, and that's dropped down to 1,100 now, 1,149. We've seen some improvement in the number of COVID related patients that have had to be in the ICU or on the ventilator. It's still a little bit up and down right now, but certainly when we look at the beginning of the year and toward the end of last year, we have had some significant improvement in that, and we hope that continues. And just remember that when we see increases in cases now, those cases that are occurring now translate into those hospitalizations later. And we're looking at somewhere around 7 to 8%, maybe a little bit higher, of our total cases requiring hospitalization. And so we know that, you know, the 2,200 cases that we see now, eventually we're going to see about 8 or 10% of those potentially hospitalized down the road. So that's where we stand, cautiously improving, but we are not out of the woods yet. We still have a lot of work to do. And I continue to encourage people, not only if you fall into those eligibility groups, to work to get vaccinated at one of our drive-through clinics, but also continue to wear a mask, continue to social distance, continue to avoid those group settings where we know that transmission can occur. And I'm going to turn it over to Mr. Craig to talk about the wonderful work that his team and other folks within the agency and our partners outside of the agency have been doing with those drive-through clinics. Jim?
Yeah, thank you, Dr. Byers. And yeah, we have had a great partnership with our friends at the Mississippi National Guard, local law enforcement, state law enforcement, EMS agencies, hospitals, lots of folks working together to make sure that we provide some vaccination opportunities here in Mississippi. Liz announced that we had 18 drive-through sites, and as you know, we have been operating 18 sites now for 3 weeks. This is our 3rd week of operating these sites around the state of Mississippi. But today, although a pretty rainy day here in Jackson, we opened our 19th facility. That was at Smith-Will Stadium. It opened up this morning at 9 o'clock. Even besides the rain, it was welcome to see a lot of Mississippians who had appointments coming in to get their shots. Probably about an hour and a half after we got that operation started, the line was moving to our system standard, which is about a 30-minute encounter from the time that you say hi to us at our greeter station and you say so long to us at the end of your 15-minute observation period. So there's a key part about these sites is that these are vaccination only sites, which means you must have an appointment for a vaccination at a vaccination site to receive a vaccination with us. So if you make that through the hotline or you make that online at covidvaccine.umc.edu, any of those ways to get that appointment, you have to have that appointment to come to the site and receive your vaccine. Looks like right now we're getting about 6,000 appointments a day in each of these locations. So that's about 6,000 opportunities per day, Monday through Friday for the mass vaccination sites that we have. So just a little update on that. Just want to make sure everybody understands that it is a great opportunity and it's a great partnership working to deliver this service in the state of Mississippi. But it's very, very important that people understand that this is that these sites do require an appointment to receive your vaccination before you come to the site. Anyone who comes to the site that doesn't have a vaccination appointment, we'll help you try to find out some of the times maybe and ways that you can get that appointment, but we cannot service anyone on the sites that do not have an appointment. So it's very, very important that they have that appointment before they come out.
Thank you so much, Jim. We appreciate that update. We're going to go to questions now, and we have the first question from Jill with Bloomberg News. Hi there, thanks for doing this. Sending a question early since you mentioned shipments. Moderna has reported delays in vaccine deliveries because of an issue with McKesson gel packets that got too cold in transit. I'm wondering if shipments to Mississippi as part of your weekly allocation, either this past Monday or upcoming Monday, are affected by this issue. Dr. Dobbs, do you want to first address this?
You know, we haven't seen any issues so far. I mean, certainly something we're monitoring and have been in communications with our immunization staff, but to date, we do not appear to have been impacted by it.
Okay, thank you, Dr. Dobbs. From Ronnie Mott, does the 37,000 allotment include doses for long-term care facilities? Paul, go ahead and take that. Dr. Byers? Okay, are you?
It does.
Sorry, it took me a second to unmute. Apologies. No, it doesn't. Thank you, Dr. Dobbs. No, it does not. That allocation method for the CVS and Walgreens federal partnership comes in a different way, and so this 37,000 represents those doses that are available directly to Mississippi for us either to utilize with external partners or through our drive-through clinics.
Okay, thank you, Paul. Courtney Ann Jackson, WLBT. It is my understanding that MSDH is going to partner with the Lawrence County Hospital on a drive-through site in that county. Is that model of partnering with local hospitals one that you plan to utilize more moving forward? Jim Craig?
Yeah, and that is true. I met with officials in Lawrence County, including hospital officials this week to look at some of their planned activities around their pandemic planning. You know, in the state of Mississippi, county governments, hospitals, and the health department and others have been doing pandemic planning for a decade. So there are some pretty good plans that are already in place Lawrence County had some of those planned activities for when they have enough vaccine available to be able to receive a vaccine in their community to deliver that vaccine. So we're definitely working with them to see if we can increase some of the geography of where Mississippians can get those shots.
All right, thank you, Jim. Shalina from NPR, we are seeing a slow uptake in vaccine by healthcare workers. Is the state seeing more hesitancy among Black healthcare workers, and what is being done to reduce the fear of taking the vaccine? Dr. Dobbs.
Yeah, so we don't have a precise awareness of the degree of it, except for the fact that early on, our initial statistics showed that around 17% of African Americans were receiving the vaccine. As far as like, you mean like of the total number, and even when it was only healthcare, that number was only 17%. So, and we know that Black folks make up about 38% of the population. So we have seen some reluctance early on. So we've seen a little bit of a trend that's been different. We've seen after people have seen their friends and colleagues and leaders, especially leaders in the Black community, Black physicians showing faith in the vaccine, and a lot of guys that you've seen our work with Dr. Phillips and Dr. Sullivan and Dr. Quinn and Dr. Turner and all these guys to show our faith in the vaccine. That's really helped. So we'll continue to do those things. We met with some leaders of some of our historically Black colleges and universities yesterday and vaccinated some folks who are eligible within their ranks. It's going to be a steady approach to try to make sure we reach folks without maybe some hesitancy, or maybe also because of other barriers to access. And so we see two real challenges. One of them is going to be trust, and one of them is going to be availability, and we're going to try to tackle those simultaneously.
Thank you, Dr. Dobbs. And this is kind of segueing to this question. This is from Alex with Mississippi Today. Can you talk about specific steps that the state is already taking or considering to help reduce the racial disparity in who receives vaccines? Dr. Dobbs, go ahead.
Yeah, so I can tell you what we've done so far, and a lot of it's is building trust through leadership. And if we know who do people trust within the Black community, it's going to be some of their political leaders, some of their preachers, right, pastors, and physicians. And we know that those are strong groups, and we've been working closely with those guys. I do have a meeting tonight with some of the Black pastors, trying to make sure that we can get better messages out. And so, building trust that way is one way to do it for sure. And that's just sort of like a tip of the iceberg sort of thing. And then access is the other issue. What we've heard over and over again is a lot of Black folks want to get it from their doctor, or they want to get it from their local clinic, because that's where the trust is. And so that's one of the reasons why the community health center cooperation has been so helpful, because we know that they do really service not only people who are primarily of color, but maybe people who maybe have other access issues that maybe won't be able to get on a computer and have that sort of thing. So we're hitting them from those sides. We're also trying to learn more. We have an extensive trust survey that's being disseminated now. We've had, I think, over 10,000 responses, and that'll help guide us. We've done focus groups, and so that'll help guide our efforts in the future, but also any future media that we pursue.
Okay, thank you, Thomas. From Anita Lee, and I think we touched on this a little bit, but we do get this question a lot. As state drive-throughs, why aren't second doses being able to get scheduled after the first dose is received? I think we touched on this. Jim Craig, why don't you go ahead and explain that?
Sure, and this is an area that will improve, and I hope that I get this improvement moving a lot faster soon. But this week was the first week that we introduced the Pfizer product in our drive-through locations as well. As you know, it has a little different logistical need in the ultra cold chain storage component that is required, as well as it's 21 days from shot to the second shot versus the Moderna at 28 days. So just making sure that we have the right products at the right locations for those second shots has been just a little bit more planning that we needed to do before those other appointments are made up, so that we can ensure that people have the shot they need at the right time at the right place.
Thank you, Jim. Okay, this, Dr. Byers, let's take a look at this together. When is the state going to release confirmed list of places where people can get vaccines? And when is the state going to release vaccination data by zip code? Okay, the first question, we did take off providers. We did have a list of providers on our website and we took that off. It's a very fluid situation. Dr. Byers, can you try to explain that a little bit?
Yeah, I sure will. And so, as eligibility criteria have changed and, we had a list up that were providing vaccines for one group, but we want to confirm that when we put a list up of a provider and we report their name out on the website, that in fact they are ready and prepared and have that vaccine and be able to administer it to those folks who are in those eligibility groups. And it is a very fluid situation. One of the things that we are continuing to work on with our partners is to make sure that we have not only provide that vaccine to our external providers, but also to have an understanding that when we do that vaccine and we provide it to them, that the expectation is that they will be providing it to those folks in those eligibility categories within their area. So we're working on that. We hope to have a list up very soon. We certainly recognize the importance of that because not everybody can get to one of our drive-through clinics easily. And we want to make sure that they have some awareness of where they can go to get additional vaccine. And so we're working on that now and just had a meeting regarding that just before this conference. So I anticipate that that's going to be pretty soon that we'll have a list up.
And Dr. Byers, the second part of that conversation, and when is the state going to release vaccination data by zip code? We have a plethora of data on our website. It's an incredible amount. Can you address this?
Yeah, I think that, and if you look at our data that compared to a lot of states' data, I think that we're already out ahead of the curve on releasing things compared to some of the other states on their vaccine data. And we certainly release it by county now, and we feel like that provides a lot of good data. That's by county of residence. And we'll certainly look at the zip code and determine if there's going to be a long-term need to provide that level of granularity. But that's a good question.
Okay, thank you. Jim Craig, let's look at this. This is from Alexis Jones with WTVA. A few hospitals in Northeast Mississippi said they were told to schedule appointments up until March, but they ran out of vaccines this week because MSDH didn't provide enough vaccines as they promised. Is this true? And when can they expect a new shipment?
So, and maybe Dr. Byers can maybe talk a little bit more to the specific part of the hospital allocation, but I will say that if you look at 37,000 doses a week, and 30,000 doses of that going to the drive-throughs to support the state drive-through operations, that leaves a very small amount of vaccine to be distributed amongst other partners around the state. So if I was to guess, it may have had something to do with the amount of effort that's going forward in the drive-throughs.
Okay, yeah. Dr. Byers?
No, that's absolutely right. And we worked hard initially to provide hospitals with vaccine to work on vaccinating their staff, their healthcare personnel, which was really one of the primary focuses early on. And we've worked to provide additional doses to several facilities. But as Mr. Craig just outlined, by the time we make sure that our drive-through clinics are supplied, we're left with a modest amount of doses to spread around. One of the things that we encourage providers and we want to make sure that they understand is that when we are able to allocate them vaccine, that's not necessarily going to be a steady supply. That they need to make plans and arrangements to utilize that defined amount that we're able to provide them. And if we send a provider first dose vaccines, we are going to send them second dose vaccines too. So they don't have to hold back any vaccine from that first dose allocation. So we want them to use it, but use it within that means, because we can't at this point promise that steady supply to those external partners.
Okay, thank you. We have a couple questions here in a row about hospital administration of vaccines. And so I'm just going to read the question, and if y'all think there's something to add, let's go ahead and add. So Nick Juden is asking, should Mississippians be looking to their local hospitals to receive doses of vaccine if they have trouble getting an appointment through MSDH or the private clinics? We've already said the majority of our vaccines go to our 19 county health department drive-throughs. Dr. Byers, Dr. Dobbs, you have any comments?
Well, I think it's going to be kind of a combination of both. But again, the primary is going to be at our drive-through clinics. Yeah. But we do have partnerships that Mr. Craig outlined a little while ago with some facilities to help provide some additional staffing for vaccination at a lot of our clinics. In other cases, some of the hospitals do have some drive-through clinics, and we'll continue to work with them to make sure that there's access for those. So I think it's going to be, in some cases, it may be the local hospital, depending upon the availability of vaccine and if we're able to allocate it to them. And in some cases, it may be to the local FQHC or some of the other clinics in the area. So, you know, right now we have a pretty static amount of vaccine that's being allocated to us on a weekly basis. As Dr. Dobbs said, about 37,000 doses. And so that leaves us with just a bit to spread out to our partners, who I have to say, by and large, are very willing to be engaged and to help. And we certainly value that partnership and appreciate them.
And like we talked about, partners include other entities besides hospitals. Anita is saying, will hospitals be receiving additional doses, and if so, when? We've already said if you administer first doses, you could administer second doses, but are we going to focus more on the partners than the hospitals?
Well, the hospitals are partners, right?
Well, I know that, but
Yeah.
I mean, besides hospitals, such as FQHCs and other clinics.
But, and if you consider, like, really a lot of the hospitals that are active now are using their clinic networks. And so if you look at, like, North Mississippi, or what's going on in Hattiesburg, or other places, they're using their clinic network to reach the population. So they're really indistinguishable. You know, we will get vaccine out where we can, as much as we can, to sort of balance things, and where we have opportunity. It's going to be a little bit lumpy, and that's just the way that it is. We're trying to pull back some vaccine from the long-term care partnership, and we may be able to share more of that, but we don't have good visibility of when more of that is going to be available. So the main thing is, and please know, we've never promised a steady stream of vaccine to anybody, even to ourselves. Because it is variable, as we've all seen. But when we get vaccine, we need to take advantage of that opportunity and get folks vaccinated and protected as quickly as possible. Our expectation is that if you get some vaccine, it's going to be gone within a week, and it's going to be within the registry. And if it's not in the registry, it doesn't count. I will say, though, that we did look at some data today, and Paul, I just kind of pinged up first doses versus dose allocated. This includes our most recent one, and it shows that 75% of first doses that have been allocated have been given to folks. So, you know, we're getting it out, and we're getting it in folks, and there's probably still a little bit of underreporting, so it's probably a little bit higher than that.
Okay, thank you, Dr. Dobbs. Marcia Clark from US Today Network. What is the state doing to address vaccine fears and ensure access among Hispanic residents? In particular, individuals working essential jobs that leave more exposed to the virus, such as the poultry workers. Dr. Dobbs, can you take that?
We do have ongoing partnership with a coalition of Hispanic groups and leaders, and actually either this evening or next week, we do have another call with them. We do use them as a mechanism to kind of send our communications. We do, as part of our disparity work, we do have Spanish language version on our website, right, to get in. We have our call center can utilize Spanish language not only for the appointments, but also for answering questions. We have our whole health equity unit that spent a lot of time on this with doing testing and also providing masks and other materials. So it's an ongoing work, but we have a whole unit of our response that's dedicated to health equity, not only for African Americans, but also other groups, such as Hispanic folks, or people who are not born in the United States.
Okay, thank you. Tess Frazier, Warren County residents are scrambling to get a vaccine, and while the doses seem to be trickling in, when could we see a larger shipment? January has been our worst month. We have 50 cases reported today and have passed the 100 mark in deaths. And this is Tess from the Vicksburg Post. So we've already kind of talked about, we get the 37,000 in, this is what we anticipate, and that that leaves about 7,000 left. And I'll leave it to Dr. Byers to explain how that juggling act works.
And Paul, I don't know if you want me to take that one, because
And
we did identify Warren County as a soft spot. And so we did find some key partners to share a vaccine with this week, a sizable amount, I'll say, but it's not going to be enough. People are always going to want more until we get far down into this. So understand that we made a pretty strong commitment to Warren County this week, understanding that the percentage of folks who've been vaccinated there is lower than the state average, but a lot of counties are worse that we're going to have to work with. Now, I think there's some other activities that are going to happen in the near future, and I might kick it over to Jim if he wants to answer that.
Yeah, no, thanks, Doc. I did meet in Warren County yesterday afternoon with representatives from the city, as well as from the county, the local emergency manager, other folks that are very interested at trying to develop a site, again, trying to increase geography of the distribution of those 30,000 doses that we have in the drive-through operations. Out at the Pemberton Mall, looks like the site that they have chosen. So we're working aggressively to help them prepare that site so that we will have Warren County open as one of our geographic locations in the coming weeks.
Thank you, guys. Kobe Vance with MPB, and Dr. Byers, this one I'll throw to you. COVID hospitalizations are dropping in Mississippi. Does this seem like a long-term trend that can continue? What do you all believe that has led to this quick decline in COVID hospitalizations?
well, the first one is I don't know that we can say that it's going to be a long-term trend. That's going to depend upon case counts. That's going to depend on the case burden that we're seeing. And I think some of the declines that we've seen, I think we're getting past the holidays now. Certainly we saw a big surge both during and immediately after the holidays. I think we've seen a little bit of moderation in our cases, and like I described earlier, a bit of a flattening in our curve now for the number of cases that we're seeing. It's mind-boggling to say that we're seeing declines when we're still reporting 2,000 cases a day, but that's just a good representation of what the overall burden has been over these last few weeks, which has been pretty significant. If we continue to see our case numbers decline, we will likely see declines in our hospitalizations, and those two things are going to go pretty much hand in hand. And so I think one of the things that may help us as well in the long run is if we can get those critically fragile persons in long-term care settings vaccinated and protected. In long term, that's going to help relieve some of the burden on the hospitals as well. And so these are all things with lots of moving parts that are all interconnected. And I think if we start to see some declines and get those folks in the long-term care setting protected, we may well see some continued declines of hospitalizations.
Thank you, Dr. Byers. Okay, Alexis Jones with WTVA. Do you know how many medical workers in the state opted out of getting a vaccine? Guys, do we know anything about that?
It's almost unknowable, because it's not that people opted out, it's just people are offered an opportunity, right? And so the demand so far exceeds the supply that people not wanting to take. It's almost impossible to determine, because we have more anecdotes than I think qualitative data that could speak definitively to that. Paul, anything to add?
No, I think you're exactly right. I don't think we have have real visibility of that.
Okay. Okay, this is from Alex. As far as qualifications, does someone need to be a resident of Mississippi? So we will vaccinate you if you live or work in Mississippi. We don't ask for any identification. And for pre-existing conditions, do people need to show proof to qualify? No, they do not. We do not want to provide any, we want to offer the vaccines. There are no barriers to coming in and getting a vaccine. You should live or work in Mississippi. And I think unless you all have something to add, we can go to the next question.
Good.
Good, okay. Nick Juden, will Mississippi be seeking vaccination of undocumented residents? Other states, including Florida, are intentionally banning the vaccination of such populations. How will Mississippi address vaccinating its undocumented residents and workers? And I would say, I'm going to throw this to you guys, but I would say just the fact that we are not asking for identification is one of the ways that we want to prevent any barriers to anybody receiving the vaccine. Dr. Dobbs, would you like to say anything else?
Yeah, we need to protect vulnerable people who live in Mississippi, and we're not, having any proof of ID or anything like that with any sort of barriers. So, yeah, if you meet the qualifications, we want to protect you. We want to protect as many people as quickly as possible. So that's not something that we're going to do.
Okay, Dr. Dobbs. Why do residents at independent living facilities not qualify for the vaccine? Well, they would for a few reasons, but I mean, if they were of the age or if they had any at-risk problems, and so from 16 on up. But you guys, one of you want to take that? And
I'm not sure I understand the nature of the question. I mean, they would qualify like anybody else. Right now, at some point we'll get to congregate settings and general population, and that will be it. Now, I don't think that they were part of the long-term care partnership. That's part of the question too.
right.
But they, if they meet the criteria, they do qualify.
Absolutely, they qualify.
Okay, thanks, guys. Okay, who is eligible to get the vaccines now? Dr. Byers, why don't you go ahead and take that?
You bet. So individuals who are 65 and older, individuals who are 16 to 64 years of age with an underlying medical problem, we have those listed out on our website and on the site to schedule an appointment as well, and individuals who are healthcare personnel. And of course, those folks who are residents or employees and staff in a long-term care residential setting, like a nursing home or an assisted living center.
Hey, thank you. From Keisha Rowe at the Clarion Ledger. Have any federal health partners reached out to give any indication on how the new executive orders signed by President Biden may help with vaccine distribution here in Mississippi? Dr. Dobbs, please take that.
No, we haven't had any direct communications with the new administration. I have had sort of brief introductory session with my professional organization, the Association of State and Territorial Health Officers, but we haven't had any direct communications to give us information about that.
Okay, thank you. All right, we've got Ann Snabes from the Meridian Star. When do you expect to make teachers and first responders eligible for COVID-19 vaccine? Dr. Dobbs or Dr. Byers?
That's a tough one. I mean, again, let's just go back and consider the numbers. 1.3 million eligible, 30,000 a week. We had a bit of a topsy-turvy week last week where we had a strategy shift to really hit older folks and people medically ill, which is a great strategy, right? I mean, we've never been opposed to that. It was just different. There was HHS sort of made that recommendation change. So it's going to take a while for us to kind of get through the demand within the current group. So I'd say stay tuned. I'd hate to commit, but I don't see it within the immediate future.
And I would add, Dr. Dobbs, that certainly those first responders who fall into those eligibility categories otherwise are completely eligible right now, as well as teachers.
Absolutely. So if you're a teacher and you meet one of those criteria, they're pretty broad criteria. If you have a BMI over 30, you qualify. If you're a smoker, you qualify. So it's not like it's excessively restricted. That's why so many Mississippians qualify.
Thank you, guys. Okay, Dr. Byers, this will be for you, Ronnie Mott, asking the expected after holiday surge hasn't seemed to materialize in Mississippi. Are we out of those woods, or can a surge still materialize?
Oh, I think we did see a surge.
I do too. I think we saw a pretty significant surge during and after the holiday. And I'm not certain that we're out of that surge yet. I think we're seeing signs that we're starting to move in the right direction. And knock on wood, those signs will continue, and we'll start, continue to see some downward trends in our case numbers. With the ultimate goal, remember, is the reason we want cases to go down, the reason we want to see those declines is because ultimately that leads to less hospitalizations and less deaths, where the real impact is. And I certainly see we saw that during the holidays.
Yeah, our peak day of 3,500 cases in a single day was after the holidays. So.
And it hadn't been too long ago that we said 98 deaths in one day.
Mm-hmm.
Thank you, gentlemen. Kobe Vance, and I'll let any of you answer this. Are there any updates on the outbreak at the state capitol? What are your all's concerns for legislators who are up and older and at higher risk of severe outcomes and travel to and from their homes across the state? First of all, if they meet the qualifications, they can get a vaccine. But Dr. Dobbs, do you want to talk a little bit about that?
Yeah, so there have been a handful of cases at the Capitol, as would not be unexpected for the number of people who are working there and the nature of their work. So we're continuing to work with them to try to find optimal means to protect their staffers, but also the legislators. There are safer ways to do things. It's the same rules that apply to them that apply to us. If you're around each other with some proximity for a long period of time and there's not good air circulation, you're going to be at higher risk. And especially meals. Meals are exceptionally dangerous. And I've spoken with leadership about how important that consideration is. It is going to be real important to get those folks protected, vaccinated, especially those who qualify. And we have had, of the people at the Capitol, 120 so far have been immunized. And those are folks that qualify based on the criteria. So we'll continue to expand that and try to make sure we protect as many of our legislators as possible. They're doing a service up there, but they're also at unique risk because of the nature of their work. And to keep them operation, vaccine is going to be very, very important.
Okay, so Bettina, I think we already answered this. For people who have gotten vaccine appointments, must they show proof they have an underlying medical condition? No, they do not. We do not want to put up any barriers to getting your vaccine put in your arm. From Anita Lee, when do you expect an update from the Biden administration on the COVID-19 national strategy, including any info on ramp up of vaccine production, spreading doses to more providers, including pharmacies? Who wants to take this?
We haven't had much visibility of anything, and most of the stuff that we've seen and heard is really a lot around the making sure that they have syringes and vials and that sort of thing. There's a natural bottleneck for vaccine production. Right? We're not going to see a doubling of vaccine availability anytime real soon. So I do want to temper expectations that it's going to take a little while, almost certainly, to really see much increases in our vaccine supply.
So Alex is asking, sorry if already addressed, but do people need to receive the first and second doses at the same location? No, they do not. We would prefer that you get it at the same location, but it is not written in stone. Shalina, seems like there aren't as many drive-through sites in South Jackson where there's predominantly Black communities. Why is that? And what's the plan to address it? Jim Craig?
So again, with limited vaccine and trying to make sure that we have vaccine available around the state, We would like to increase geography, and we're going to work with some partners to try to help do that. But with the limited doses that are available in our state, there's really just no way to have vaccine available everywhere in the state at the same time.
Thank you. Any of you guys want to add anything, doctors?
Yeah, we are working there with partners though. Jackson Hines has been a great partner. And we're working also with Central Mississippi. It's not a one solution fits all problems sort of situation. But again, I mean, the demand in vaccine, but also the demand in geographic spread. I literally spend probably hours a day fielding requests for vaccine. And there's, will be equitable to try to meet the objectives, but everyone's not going to be satisfied right now.
Okay, Ronnie Mott, can you outline the logistical challenges with the feds only giving week-to-week allocations? Any insight on why the feds are so, quote, stingy with allocations? Are those amounts, Thomas, Dr. Dobbs, based on population at 37,000 a week?
Yeah, so I mean, our understanding is as they get it, they give it to us, right? And so it's we're real-time inventory, and I think they're real-time inventory. So I think it's really just dependent upon those things. We have to have different planning assumptions. Our planning assumption needs to be that we give it as we get it within the reasonable expectations of regular distribution. So I think it's just the nature of having a new vaccine with a lot of demand, and we're using real-time production as our mechanism of distribution.
Okay, thank you, Dr. Dobbs. Alex Jones, WTVA 9 News. Why do the state allow people 65 and up to get vaccines if the first group struggle to get appointments? I think we've addressed that, but would any of you gentlemen want to say anything more about it?
Yeah, there was a pretty significant national shift in the guidance for doing that. So that's one thing, is let's go ahead and open up as much as possible to reach folks who were at highest risk for bad outcomes. The other side of it is even, it's just such a big group. It's really kind of challenging. Even as we were going into that next week, we actually did have a few open appointments in a couple of spots across the state. So we didn't have 100% saturation. It was like 90% saturation maybe, but we needed to make sure we had 100% saturation. And I think that, that along with the change in national priorities sort of motivated the shift.
Okay, thank you, Dr. Dobbs. All right, Ali Herrera with WMC Action News 5. Has the vaccine supply ramped up at all since the beginning? Did we receive, have we always received the 37,000 based on population, or has it increased?
We got a pretty big influx early on, right? I mean, we had 1 week, we had like 50,000, maybe 51,000. So, whatever they had sort of saved up, they gave us a lot earlier. Paul, you want to sort of tease that out?
Yeah, there's some variability with that allocation that we get from the federal government. And they're early on, there was 1 week where we didn't get a whole lot, and we got a little bit more the next week. And, for these last couple of weeks or so, we seem to have settled down into that 37,000 doses. But that's not a static number either. I mean, we're getting about 1% of the total federal allocation, because that's about what our population is. When do we expect an increase? I wish I could tell you that. Right now, we're living that week to week, and we are making sure that we get those doses out so that we get them in a position to be used as quickly as possible. And that's kind of the challenge of the planning now. There's not a delay in getting second doses. We are getting a second dose allocation that matches the first doses we received for Pfizer and Moderna, and we're getting those out to the appropriate providers, either to Mr. Craig and his crew for the drive-throughs, or to our external partners that we've already provided first doses to.
I think what Allie may be getting to is you do not have to get your second dose on the exact date. It allows for time after the date.
I get what you're saying.
Would you talk to that, Paul?
Yeah, no, and so there's a there's really a minimum time frame between those first and second doses, depending on the type of vaccine you got. If it was the Pfizer vaccine, there needs to be at least 21 days between the first and second dose. And so if I've gotten Pfizer, I need to get my second dose 21 days from now or later. And the same with the Moderna, except it's 28 days. And so there's not an end date to that. It's just that minimum time frame needs to be 21 or 28 days. Depending
Thank you.
on the vaccine you got.
Thank you,
But
Dr.
we don't
Dobbs.
expect any delays in that.
Okay, wonderful. With case numbers seemingly rising at the Capitol, Dr. Dobbs, what advice has been given to leadership about a potential delay?
We've had a series of conversations with House and the Senate. We've gone over different options. And one of the questions that has asked to me is, what would you do if this were a private business? What would your recommendations be? So I went through those, and there's options you can do. You can send everybody home for a little bit, or you can have everybody go virtual and not meet together and that sort of thing, or other measures you may want to do. So they're weighing those out, and it's a lot more complicated than a normal business, though, right? So it also is a complex organism with a lot of demands and a lot happening both during session hours and after hours. So but I'll say one thing that's going to be very important is really the same stuff that we recommend for anybody is after hours social stuff needs to be done very cautiously. Meals with people who are not in the same household are going to continue to be dangerous, and I think that's something that we really need to they need to look at.
Thank you, Dr. Dobbs. The CDC lists other pre-existing conditions, including asthma and liver disease, that might bring an increased risk to COVID-19 patients, in addition to the state's qualifying conditions. Do you suggest anyone who suffers from those other conditions seek out the vaccine right now?
Within the CDC category, there's the main ones, and then there's this really complicated sort of list of things that you need to take into consideration. Rather than trying to do some sort of advanced algorithm for people to work through on the website, if you don't fit one of those main conditions, we really recommend you to get with your physician and see if the illness that you have underlying is significant enough that you warrant seeking immunization at this time.
Okay, let's see. Isabel Tapp. What is MSDH doing to ensure vaccine access for older Vietnamese Americans here on the coast who don't use English? Will the state offer appointments that don't require IDs? Isabel, we don't require IDs from anyone at all. You need no proof. And again, that is because we want everybody throughout Mississippi to feel comfortable when they qualify to get their vaccine. Dr. Dobbs, did you want to add anything?
Yes, sure. So we do have had some Vietnamese folks to get vaccinated, and our health equity team does have a presence working with that community. We have Vietnamese language translators on the call line, and we're working to make sure it's also available through the scheduling portion. So we recognize that as a group that's valuable and needs to be protected, and we'll continue to work to make sure that they have equal access.
Thank you, Dr. Dobbs. Jim Craig, I think this is to you. Well, we do have breakdown by race on who has received vaccinations, don't we, on our website? On that one report. So you can go ahead, you guys go to our website because there is just a plethora of information. Also, I'm hearing there were plans to put a drive-through vaccine site at the fairgrounds, but was scrapped due to the Dixie National Rodeo. Is this true, Jim?
I'm not aware of any planning around that. We've been looking at a couple of locations in Hinds County for a while. And Smith Wills was really kind of where everybody pointed us toward. So we have made that site available. And as we announced, it's our 19th site opened up today.
Yeah, that is great news. And so that answers the next question, because we have opened up a site in Hinds County. Thank you, Jim. Okay, what is done for people in rural communities that cannot make it to a drive-through? Who wants to take that?
Yeah, so we have 37,000 coming in, and we give out 30,000 to drive-throughs, and with that other 7,000 or so, that's where the priority is. And last week what we did is we apportioned it to the different parts of the state based on population. and tried to find strategic partners that could maximize that, whether it's community health centers or hospital partners that had clinics that had sort of outlying, rural areas where they provided healthcare. So we're going to continue to do that. Is it going to be perfect? No. I mean, even if you live in Jackson, you have trouble getting access to vaccine just because the demand is so high. We recognize that's a real challenge. But also, in addition to that sort of attempts to provide balance, we are ever expanding our footprint on drive-through locations. So just expect to see more and more happening on that within the coming weeks.
Thank you, Dr. Dobbs. Go ahead, Jim.
Well, the only other thing I would add is just things that we've seen at the drive-through site. Some churches have assisted in some of their members getting to the drive-through site. We've seen that occur. We've also seen some local governments that have been involved in trying to use some of the transportation resources that they've had to help people get to the drive-through. So there are a number of good things going on, and that's what we do in Mississippi, right? When people need help, there's always seems to be someone out there to try to help. And I think we've seen that in the drive-through operations.
Thank you, Jim. So Dr. Dobbs, we have 36 more questions. Are you able to stay? I'm so glad. We promised reporters we answer their questions. So I don't want to cop out, but do you need to leave?
I'm good till about 2:20, and then
Okay.
I do have an existing commitment.
Yeah, you guys just need to talk faster, which should be no problem for you, Dr. Dobbs. So, okay, let's see. Nick Juden, I understand the technical aspects of this, but the question remains, should Mississippians be calling their local hospitals and asking to schedule shots?
If they have them, I mean, the local hospitals are letting you know if they've got it. In George County, they've got shots. Lackey Memorial has shots. Hattiesburg Clinic, in their partnership with Forest General, has shots. So you can ask your local hospital and see if they have something going on, because there are things happening all over the place. Some of that's reserve inventory they're getting out. So yeah, sure. I just wouldn't have the expectation that it's going to be available in all locations.
Thank you. Ms. Bettina with Listen Up Y'all Media of Natchez, I don't have a question for you, so I just see your name up there. So if you want to go ahead and send in a question, please feel free to do so. We'll move on to Anita Lee. Will long-term care vaccines be 95%, a long-term care provider? I think she's talking about the long-term care facilities. The 95% administered over this week and next, the goal the governor set. Gentlemen.
We hadn't seen it yet. We don't know if it's a delay in reporting or not, but when we ran our reports today, there's 13,000 doses given to the long-term care partnerships. Now, it may well be that there's a reporting delay, but that, we received the same information, so remains to be seen. I mean, there's progress being made, but will it meet that threshold? I do not know.
Okay, thank you. Kathy Cook, are there any plans to add a drive-through vaccination site in Pearl River County? Jim?
So we did meet with some of the officials in Pearl River County to discuss some potential sites there, and we are exploring some opportunities in that location as well.
Thank you. And Rachel with Politico, are you anticipating more vaccine next week? I think we've addressed that. We anticipate 37,000 doses weekly. And have you heard how the Biden administration plans to allocate the vaccine? I think we've addressed that. Dr. Dobbs, do you feel like that's been addressed?
Well, there's that one question about rewarded or punished based on your getting the doses out.
Right.
We just heard sort of rumors and rumors of rumors, but we're going to go forward like that is the plan. If you look at what we've done if you discount the long-term care, which they've been allocated about a 20%, maybe even 25% of our total vaccine. If you look at the rest of it, Mississippi is doing a rocking good job getting vaccine out. Not that everybody's satisfied because there's a lot of demand, but we're doing a fantastic job getting folks vaccinated.
And I will tell you, because I talked to my counterparts in the surrounding states, everyone's having problems with, hotline capacity and scheduling. And our team, UMC and NEMA, have worked tons and tons and tons of hours last weekend to accommodate a lot more people. So we're very grateful to that. It's another Biden question. Is there any evidence that the Biden administration will alter the allocation strategy of use it or lose it?
And I think my same response sort of applies. Is, we don't know, but we're going to go forward pretending like, or anticipating that could be part of it, which is good anyway, because we want to get folks protected as quickly as possible.
Okay. Anita, thank you for your kind comments. We appreciate working with you each and every day and how you get the word out. Jasmine. Okay, this is not media. Oh, well, it might, yeah, it is. Okay. Dr. Dobbs mentioned earlier that you all were meeting with African-American clergy today in efforts to increase trust with the Black community. I think he said tonight. If this is not a focus group or a closed group, would you share that meeting information with me so I can share what comes out of the meeting with our African-American clergy across the state? Thomas, do you want to?
This is a planning meeting just with folks. So
Okay.
It's not really a public meeting.
Thank you.
There will be some though. I know we've done some before, and I've got one with JSU this evening too. I'm not sure if it's a public meeting or not, but if it is, I'll share that.
And we plan, do we not, to do some town halls in various areas? I think that's a great way to reach folks out there. Okay, thank you, Jasmine. Okay, Nick Juden, I understand that the ability to know with total accuracy how well you can spread the virus after vaccination requires study. But for the thousands of Mississippians approaching their second dose, how should they realistically act? This is a great question. 2 weeks after their second dose, how close can they come to a return to normalcy? I threatened that with Dr. Dobbs. I was going to go out and party, and he said, no, you're not. So Thomas, why don't you answer that?
Yeah, no, it's going to be a while before we're able to really think about any sort of normalcy. I think the closest that we could expect would be summer, and Paul's probably thinking that's way too early. So but let's just make normal not that bad, right? We're not saying you can't go to work, you can't go to school, but we're saying you don't really need to have big groups, right? You need to do stuff outdoors, and as the weather gets better, that's going to be easier. So let's just continue our sort of our business and economy a friendly approach, where we do with the things we got to do. We wear a mask in public, we limit social gatherings, and if we're doing, we keep them small and outdoors. And if we did those simple things, I swear to y'all, if we would just say, hey, let's just really do that and see if it works. If you give me a month, you'll be like, oh my gosh, it's a miracle. And if we combine that with the vaccine, I mean, it'll be beautiful.
Thank you, Dr. Dobbs. So we got to continue on with practicing all the social guidelines, even if we've had our second dose. Okay, WJTV. Why was there a decision, and who made the decision to not initially put a drive-through vaccination site in the most populous county in the state until now?
That's always been in our planning assumptions. I mean, we went to where we get vaccine out quickly, and Trustmark Park in Rankin County is easily accessible through interstates to as much people as possible. So that was planned to cover Rankin and Hines and meet as many people as possible. But then also there's planning considerations we had to do, because it's a huge operation to set up a drive-through. I've had people ask me over and over again, why didn't you go to the medical mall? And it really, for the traffic flow, it's just not possible. I think if you really look at the logistics of it, you got to have the right place. And Jim knows this inside and out.
And the other thing that I would add is that, a lot of our locations, we were doing COVID testing, and we turned those same drive-through COVID testing tents into COVID vaccination tents. Here in the capital city, for the capital city testing location at the farmers market is our busiest testing location in the state of Mississippi. Instead of decreasing testing activities, we just really couldn't do that and meet the demand for testing in the city of Jackson. We had to find another location, and it just took a little bit longer to find that other location.
Okay, thanks, guys. Nick, is there a central location to find hospitals with shots besides calling them directly? Anyone want to take that?
Go ahead, Thomas.
No, not right now. I mean, we are going to put some more stuff out where things are, but it's kind of a dynamic thing, and we don't control the hospitals and what their supply is. So it's really not manageable for us to know when they do and do not have shots available, because some of them are burning through their inventory. And then so maybe after a week, I don't think that they're even going to be available anymore. So from a person-to-person perspective, I mean, you can check with your local hospital. we're going to work on giving you an updated list of where some localities are to get the vaccine. But it's going to be hard to have sort of like a standard dependable list because it is constantly in flux.
Okay, I was about to say I don't see any more questions, but I do think I see a few. Let's see. Do you believe Biden's 100 million shots in 100 days is a goal that can be met?
If they have the vaccine, we can meet it.
That's right. Give us the vaccine, we'll do it.
That's the bottleneck, is the vaccine supply.
Right, that's exactly right. Okay, so let me see. Okay, so I am going to close this out now. It appears as if we've answered all questions. Dr. Dobbs, any final thoughts?
No, thank you guys so much. It's an exciting time, but it's also time to be cautious. We have some signals that we can be somewhat optimistic. We're seeing a decline in cases, but still 2,200 cases is nothing to sneeze at. We're seeing a decline in hospitalizations, but we're seeing a great number of deaths, and expect January will be the worst month for deaths. If you have any doubt, just open up the newspaper and look at the obituaries. The length of the obituaries is 2 to 3 times normal that we normally see. So be hopeful, but be careful.
Thank you, Dr. Dobbs. Dr. Paul Byers.
No, just stay the course, guys. It's not time to throw in the towel, you know, and I'd hate for us to really get this close to the end zone and not make it through. We've got a vaccine coming. Now's the time for us to continue to bear down and do those things that we know have been working and really redouble our efforts to make sure that we limit transmission until we can get more folks vaccinated. And that's going to take a little bit of time when you look at the total number of folks that are eligible for a vaccine just in this first round. So hang in there with that.
Yeah, I think Paul brings up a good point. If you all could illustrate 1.3 million people qualify, and we're getting 37,000 a week. People need to understand that you will get your second doses. Just be calm and check with the scheduler. Jim Craig, the man who's responsible for our 19 county health department drive-through sites, do you have anything?
I just want to say thanks to the media for being part of this with us today, but really thanks to those team members from the health department, the guard, local law enforcement, the EMS groups, everybody that's part of the drive-through operations that are out there when it's raining, when it's cold, every day to try to make sure that we get this vaccination effort moving forward in the state of Mississippi. So I really appreciate the team that's out there getting this done every day.
Okay, thank you to all of you, and thank you to the media. We appreciate you, and we'll be in touch soon. Have a great afternoon, everyone.